to our show, a specialist in vascular surgery from Henry Ford Jackson Hospital, Dr. Paul Corcoran. Welcome back to the show, Paul.
Great to be back. Thanks for having me.
Yeah, good to see you.
Good to see you.
You've been a specialist here in our community for many years, helping people with vascular issues.
Mm-hmm.
We probably should define what is vascular health.
Big topic, but I think in general we're talking about diseases outside of the heart, outside of the brain, of the arteries and veins. So when people talk about problems with their circulation, they're referring generally arteries, veins, leg issues.
So what kinds of things, like are there diseases or conditions from?
Yeah, same thing that can affect the heart. So we can develop hardening of the arteries as we age, and for a variety of reasons. We can develop blockages that may or may not cause symptoms. We can have problems with our veins, which can give usually issues with the legs, swelling, and other changes that can occur. And that's primarily what we deal with.
And I think I have a friend that told me he got a diagnosis, calcification.
Yeah.
And he panicked, but it's normal.
It's normal. So it's a generic term, but you know the process of what happens to our arteries when someone says hardening of the arteries, they're not always hardened. Plaque can take the form of very calcified plaque. It can be soft. It's a mix of things, but at the end of the day, it's important to know what symptoms it can cause or not, and can it be silent, and why do we do screenings and things of that nature.
So how do you screen for vascular issues?
Well, and I think we did that a few years ago, right? And
that's right. The Wayback Machine here at JTV found a clip from when we came out for. I
had less gray hair then.
I think we looked the same, but we actually went out to. I think we went to Jackson College. Yeah.
Yep. And so, you know, I think what we did here, and I think we demonstrated some of this on you. We did a vascular screening. Our vascular lab does a screening usually once a month, and we do three things. So we check the arteries in the neck, so we look for blockages that could potentially increase risk of stroke. Mm-hmm. We look at the main artery in the stomach, so an abnormally enlarged artery that could potentially be life-threatening. And we check some measurements in the legs to look for evidence of poor circulation in the legs, or hardening of the arteries, as people would say. And that test takes about 20 minutes, and it's painless. And if patients, particularly over the age of 50, if they're interested, they can call area code 517-205-1301, and they can inquire about a screening at our lab right over down the street at Rose City.
Now, there are some things that people can be on the watch for in terms of symptoms if you're having like a stroke, right?
Right. So with stroke, we think of an acronym called FAST. So facial drooping, arm weakness, or difficulties with speech. So someone can't hold their arm up or arms up. They have difficulty talking or are throwing out words in a meaningless way, what we call a word salad. And then the T of that is time. If you recognize those symptoms in someone, to call 911 and get help immediately. But you know, these things can be silent. We talk about aortic aneurysms a lot. That's something we treat commonly, an abnormally enlarged artery in the stomach that can be silent until it's not, and it can be fatal. So screening, again, becomes important. Visits with your doctor, physical examination, all important things. Knowing your family history, for example. People can present with leg symptoms. They have difficulty walking as far as they may want to. They get cramping and tightness in their calf muscles. These are all things that can be signs of artery disease.
All right, so I've been in the ER when someone's come in with stroke symptoms, and it's like all hands on deck. You clear the whole place and you bring everybody to a table, and it's like speed is of the essence. What's the deal about the speed?
So the longer it takes to restore normal flow, so there are certainly emergent interventions that can be done to potentially resolve some of the causes of stroke. And time is of the essence because you got to get blood flow to the brain. So the longer it is ongoing, the more brain you lose, and the more you lose, you don't recover it, or it may take longer to recover. So it's like a heart attack. You want to minimize the damage and reverse those blockages as quickly as possible.
You hear sometimes people comment that, oh, they've had a series of mini strokes, or they had a slight stroke.
Right.
I mean, are there different?
There are. So when we say mini stroke, generally we're talking about a TIA, or transient ischemic attack. we're talking about something that lasted less than 24 hours by definition. Sometimes things can last 20 minutes. And there's a lot of things that get labeled as a stroke or a mini stroke, and they're not. So it really takes a careful evaluation and imaging to really determine what happened.
So let's say you get one of those symptoms, your arm droops or your speech slurred, and then I'm fine. It went away. Does it go away?
It can.
Yeah.
It can. It can go away and you can be back to normal. But it's not something I would ignore.
No.
So, a trip to the emergency room, a call to the primary care doctor, but some urgent help.
So if it went away, you're lucky and you got
Correct.
a second lease.
Correct. Yes, it's like the check engine light just came on and you need help. So not something to ignore at all. And that simple acronym of FAST is face, arm, speech, and time. Get help, or if you're witnessing that in someone, get them help quickly.
And as you're experiencing, you might not even realize it.
You might not know,
Yeah.
right? So, or you're not able to call for help, especially if you're having difficulty speaking. But someone may notice subtly a face droop, something of that nature, and you're not aware of it.
Yeah, and if you're talking gibberish, you might not even know you're...
Correct.
All right, so what are the treatment options?
So it depends on the cause. Sometimes in the emergency room, depending on the cause, they can administer a clot-busting medicine. There are specialists called neurointerventional radiologists that can actually track into the small vessels in the brain and sometimes retrieve the offending problem. Most of the time, when it involves us, we're dealing with the arteries in the neck. And blockages in the arteries in the neck can be a source for a stroke. And there are two things that we typically do. We can do what's called a carotid endarterectomy. We can open up the artery and actually clean the plaque out that caused the problem. Yeah, very commonly performed operation. For most patients, it's a day in the hospital. The other thing we can do is put in a stent. We can actually make a tiny little incision at the base of the neck, and through that we can insert a stent to treat the blockage. So very minimally invasive procedure. Again, overnight stay in the hospital, very quick recovery for most patients. And in the setting where a patient's had a stroke and we're involved, usually we try to intervene within 14 days. It really depends on what's going on with the patient.
Well, we have miles of veins running through our body. You can't go through and clean them all out.
No, and unfortunately there are some instances where things are at a point where we can't fix it. But so that harkens back to the importance of screening, the importance of early intervention for the things that cause these issues in the first place.
All right, what can we do to avoid ever having a stroke or vascular disease?
So the first thing would be to never smoke. If we could somehow get rid of cigarettes, I'd have a lot less business. And then, early intervention for things like high blood pressure, high cholesterol. Diabetes is a big offender in terms of, the things that we deal with every day. So healthy diet, exercise, and appropriate treatment of those risk factors is how we reduce risks.
Are there some things that are just genetics
Sure.
that you're not going to be able to do anything
Absolutely. There can be a genetic component to high cholesterol, for example. And that genetic component makes it sometimes harder to treat. It's hard even with medications to get patients to the target thresholds you would want to get to. In my experience, when patients come in at a younger age, so less than 50, I've had some 40 and even some 30-year-olds who've come in with problems. You don't typically see that, and they generally have a very strong family history of heart attacks and strokes. And so knowing your family history is very important. So for example, back to the aortic aneurysms that I mentioned, slightly higher risk in family members. So if mother or father had an aneurysm, particularly if it was mom, risk is slightly higher. So getting screened, again, very important for people with a known family history.
All right, let's talk about smoking, because it's not just smoking, it's the nicotine, I understand.
Right.
And people are consuming nicotine through vaping, through little pills or pouches, gums.
Right. Yeah.
And that's not good.
No, and not surprisingly, making it into the younger kids. My kids play hockey, and you find those little nicotine pouches all over the locker rooms. And, we don't know, particularly for the pouches, what the long-term consequence is there, except I don't know if they're getting an energy jolt out of it or what, but tobacco-containing products, nicotine products, vaping, all things to avoid. But for us, smoking, cigarettes, cigars, tobacco-based products, it's just so detrimental, not only to the patient, but then when we do interventions to try to help patients with their symptoms, the ongoing smoking is detrimental to what we do and reduces the long-term success of what we do. So really, that's the single best advice I can give to anyone is just, A, don't start, and B, quit. And it's not too late.
Well, you mentioned 50 as
generally just because it's this is a disease predominantly as we get older. It's very much less common to find it in younger patients unless they've got that really strong family history.
How often should someone have a vascular screen?
Yeah, so every 5 years we recommend a screening, and unless something is found. So what'll happen if we identify something on that screening, that information will be sent to your primary care doctor. The patient will also get a copy, and we encourage patients to discuss that with their primary care doctor, and then depending on what the issue is, there's set screening intervals that we will do if an intervention is not indicated at that time.
All right, so the fast symptoms, the drooping, the arm.
Yep.
What about, is there something like an ongoing condition like shortness of breath or
Sure.
difficulty walking upstairs, anything like that that can be a symptom?
Absolutely, because if, really what we tell patients is, why is it important to get screened? You may not have any symptoms at all. So if we detect presence of artery disease in a patient with no symptoms, really it's more important than to get your heart checked, because if you have it in your legs, you can certainly have it in your heart. So shortness of breath, chest pain, decreased exercise tolerance are all things that should be a warning sign to a patient that they really need to see their doctor and be examined and have appropriate testing.
What about diet? Things like fats or salt?
Salt for sure, as it relates to high blood pressure and water retention. As much as I like my red meat, like cutting down on the red meat, a lot of chicken and fish, avoiding fried foods, fresh vegetables, fresh fruits, things of that nature. And in fact, I think there's a website, healthyplate.gov, gives you a nice outline of what you should have on your plate and what you shouldn't.
So there are some things...
Or at least in moderation.
Yeah.
Yeah.
And as far as reversing, like once you're starting to get the calcification, the hardening, it doesn't, you can't...
It doesn't go away, we can't reverse it, but we can certainly slow the process. And then with appropriate medications, can we reduce the risks? And we've learned a lot over the last number of years about just the medical management. So the other thing your viewers should know is coming to see me doesn't always mean surgery for what you may have. And our knowledge about the medical management of artery disease has gotten so good that medicines alone can significantly reduce risks. And there's a lot we're learning, and big studies that are being done currently that'll sort of guide the next 20 years of how we manage the diseases that we treat. The biggest thing I would advise people is just don't be afraid to get screened. Don't be afraid of what you might find. Early treatment, early diagnosis can really, and then connecting with your doctor and discussing those things can lead to a better outcome.
Awesome. Tons of great information. And once again, the number for setting up the screening?
It's area code 517-205-1301. And they can give you all the information you need on when the next screening is and how you get one.
Great. Good to see you. Thank you.
Good to see you. Thanks.
Vascular surgeon, specialist in vascular health from Henry Ford Jackson Hospital, Dr. Paul Corcoran. Our next guests are from